breathing new life while trying to save their own.
And I didn't know if I was going to even survive that day.
This is my body. I know what's different.
Some Iowa mothers say their cries fall on deaf ears at the doctor's office.
And I was going through a traumatic state and no one bothered to tell me.
In between contractions to be quiet, to respect other mothers.
Doctors agree change is needed. But the biggest question these mothers are asking,
what are the solutions?
How do we make them listen?
I'm KCCI 8 News anchor Tisia. Women are dying because of pregnancy more and more each decade in Iowa. That jumps 6 times higher when that woman is Black, according to the latest report from the Iowa Department of Public Health. When it comes to other minority groups, that number becomes more unclear. But death isn't the only issue they're facing. We spoke with 2 Black mothers in central Iowa. Both went through similar trauma during the most precious and vulnerable time of their lives. Throughout the conversations, they go into graphic detail about their pregnancies, and they want you to listen.
It was very hard. One of the things that really put a damper in my whole birth experiences was the nursing staff from the birth of my daughter 3 years ago.
Go girl, it's your birthday.
Zora's 3 years old. She is a Leo, so if you know anything about Leos, they know what they want. They, think they're their boss, and I just love it. It was about 8 doctors, and so it wasn't as personable. They really didn't get to learn me and my body and my experiences as a patient, as a pregnant woman, because I was seeing so many doctors every time for every appointment. The lights were bright, right? And it was just a lot of people, different people coming in and out. I was asking my partner, Justin, I'm like, who is that? Who is that? Well, I'm sitting there screaming, and then I have one, nurse telling me to keep it down. And then Justin, later on, my boyfriend, he told me that the nurses were talking about me, saying oh, she's just so loud.
This is my 3rd baby, 4th pregnancy. I had a lot of issues. High blood pressure, swelling to the point to where I couldn't really stand for more than 10 minutes. Just headaches and things like that. And it was always, oh, you're fine, you're okay. But everything pointed to preeclampsia, but no one ever diagnosed me. I was never given any medication for anything. And so it was it was a struggle because I had to continue to go to work and continue to be mom and wife and things, and not sure how my birthing process would turn out. Well, a couple of days it had got unbearable, and waiting to go in to see the doctor, I had a miscarriage. I lost it in the bathroom at the hospital.
Have you had any nurses or doctors of color throughout any of your pregnancies?
No, I have not had any. They have been white, yeah.
One of the issues making it hard for our state to track the number of women of color who are dying is Iowa's lack of diversity. The report released by the state last summer draws data from 2018 and 2019. It looked closer at pregnancy-associated deaths. That's when the woman dies during or within 1 year of pregnancy. The report shows 80% of those who died were white, 13% were Hispanic, and 6% were Black. Comparatively, white Iowans make up 90% of the state's population. Nearly 7% are Hispanic or Latino, and less than 4% of Iowa's total population is Black. That means mothers of color are dying at a proportionally higher rate than white moms in our state. Another concerning number, this report says structural racism and discrimination were contributing factors in 40% of those cases. Well, the issue of women of color dying more than white women is difficult to track because white women account for about 87% of births in the state, meaning there's just not a lot of data for the state board that tracks this issue.
They can't report events that have an absolute count of less than 5. And so then when you're looking at something like maternal mortality, which is still quite rare, and then you're then further trying to disaggregate that down by the race and ethnicity of the person who died, the count is going to always be less than 5.
That's Dr. Stephanie Radke. She teaches students at the University of Iowa and works to stop medical racism before it can start.
I think that when the care is not standardized, it's an opportunity for provider bias, whether it's conscious or unconscious, to enter.
But Dr. Stephen Hunter, who has been on Iowa's Maternal Mortality Review Committee for 18 years, has a different view.
I've personally never seen anybody treat someone in my institution of color pregnant different than they would anybody else. We try to give everybody top level 4 care. Could it happen when I'm not seeing it? It could.
One major issue complicating the problem, fewer places to seek traditional care.
We've seen 44 labor and delivery units close in this state since the year 2000.
Dr. Rebecca Shaw at Des Moines University has seen the same thing.
That doesn't mean that our Iowa women aren't getting pregnant anymore. Some of them are still just arriving at emergency rooms of hospitals where there is no OB care provided.
So with care options dwindling and some leaving women of color with lasting trauma, they turn to alternatives, like doula Ebony Bailey.
How is it that I can have even just the smallest impact in my own community, in my own state? How do I do this in Iowa? How do I give back? How do I make sure that people don't have birth trauma, and that warmth and compassion that I received from my midwife, how do I give that to other birthing families?
Both Bailey and doctors are left with a tough task.
We have mothers dying every year, and we need to pay attention to why that's happening and to whom is that happening.
Well, a lack of data leads to another issue when it comes to minority mothers in our state. There is no concrete record of how many Asian, Latino, Native, and mixed race women are dying. And that's why the state's Maternal Mortality Review Committee only meets every 3 years. They just don't have a lot of information until then. But the CDC is pushing these committees to now meet every year. And we reached out to different groups representing communities of color across the state. Common barriers for Hispanic, Latino, Asian, and Indigenous Iowans can be language, the availability of interpreters, and the lack of options in rural Iowa. A Hispanic woman in Des Moines highlighted some of the struggles she has seen in her community.
I see how the interpreters are not working, or they're not, and they don't have enough interpreters, or they can't give them the care that they need. But I personally think a lot of the people that come from different countries, they don't know what to expect in El Salvador or in Honduras or Latin America, for instance. A lot of that care is still done by house.
Well, stats concerning the Asian American and Pacific Islander community in Iowa are non-existent, according to local activist group Monsoon. Organizer Mira Youssef says they are in the process of performing a community assessment regarding health in the AAPI communities in Polk County. She says that will include reproductive and maternal health, and they hope to have a report ready by September. And we did reach out to the Meskwaki Nation several times to see if they could speak on this topic. A spokesperson said they were not allowed. There is no specific data available on Indigenous people who live in Iowa, but the Meskwaki Nation has a maternal child health program. It provides services to pregnant and parenting families with Native children under 3 years of age in Tama County. The program is provided through the Meskwaki Tribal Health Clinic. It is free to all eligible families. Just head over to their website to learn more. But for Black women, this issue has been going on since modern medicine began. Experts say it started from the time Black women were enslaved hundreds of years ago.
This brings us all the way back to 1846. Dr. J. Marion Sims began experimenting on 7 Black women, seeking a solution to a common complication. It's called an obstetrical vesico-vaginal fistula. A hole is torn between the bladder and vagina, leading to incontinence, severe pain, and many other problems. It was often the result of long labor. Dr. Sims has been praised for finding a fix, but many are now recognizing it came at a cost. Some scholars say Dr. Sims did get permissions from these slaves, even insisted on it. Others say that's simply not possible, considering how little slaves' feelings and fears were considered. But without debate, Dr. Sims is known as the father of gynecology. Fast forward to the 1920s, and Margaret Sanger arrives on the reproductive rights scene. She's credited with creating the first ever birth control pill. But Sanger is also accused of targeting it towards minority and low-income women, using eugenics as her reasoning. Fast forward again to 1991. The FDA gives the green light to the Norplant contraceptive. It's composed of 6 little rods that can be inserted into a woman's arm, and it works for 5 years. But some state lawmakers quickly saw an opportunity. The New York Times reports 20 measures were passed by state legislators in 13 states between 1991 and 1992. Many involved were trying to compel women on welfare to get the implant, sometimes for money. Straight ahead, how abortion rights fit into the conversation.
We're going to be faced with a public health emergency. We already have some of the highest maternal morbidity or mortality rates of any developed country in the world.
How the Supreme Court's June decision could contribute to this pressing problem. Plus, the program's hoping to help Iowa mothers.
If you need to decompress from a birth, we're here.
I started second guessing myself, right, which I should have never had to do.
Even beyond the delivery room.
It is scary bringing home a baby for the first time.
And firsthand accounts of the bias inside Iowa hospitals.
Welcome back. We just detailed for you how racism plays a role in the history of reproductive rights and ultimately whether a mother dies because of a childbirth. Medical professionals and mothers are sharing what they've seen and gone through, finally voicing their frustration.
They think that black people don't feel as much pain as white people. You know what they say, like, oh, black people have thick, tough skin. They're not taking my pain seriously. Like, they think this is a joke. They think I just want to be in a hospital, you know, screaming through contractions just for the fun of it.
Well, I'm a woman, right? Pain is pain, as well as the idea of I know my body. This is my body. I know what's different. I know when something doesn't feel right. And for them not to listen, I'm not sure if it's an unconscious blinded bias or if it's intentional to just say, oh, you're fine, I have other things to do. But I do believe that it's something that does need to change.
We know the history where Black women were used as experiments, right? And so we want to make sure that we address where we're coming from, where we've come from and the things that we've endured and why we struggle trusting physicians today.
But for everything that stands in the way for Black mothers, there are others clearing the path.
This is a hard conversation to have. The data doesn't lie. So the question is, what are the solutions? And
Pastor Stephanie Moody is the Health and Equity Coordinator for Count the Kicks. They teach expecting parents what might happen while their baby is in the womb. Doulas are with mothers through all 9 months as well, and postpartum. Ebony Bailey became a doula after her own difficult birth. She has one solution in mind.
You're here to help me, but in a lot of cases, you're not helping. When's the last time providers had cultural training? If you're serving the Congolese community, what is it that you actually know about that community?
Another service offered in Iowa comes from Every Step. Jennifer Boding matches up mothers with nurses. They're with them at home until the child is 2 years old.
Some clients are treated a little differently than the others. It doesn't have to be color, race, ethnicity. It can just be that they're vulnerable clients in their own way of just being pregnant.
And as Iowa's population diversifies, Dr. Rebecca Shaw at Des Moines University says the medical profession is lagging behind.
We need more physicians of color, and we certainly are headed that direction, but that has not been as dramatic as has the shift in gender diversity in my field.
But while patients and people like Dr. Shaw wait for that diversity to come, a common message is coming together.
The only way things can persist is if you act like they don't exist. And when something changes, speak up. And if they're not listening, speak a little louder.
Trust yourself, and if anything is, you're like, that's off. I don't feel like she's paying that much attention to me, right? You can have a conversation about it, and if you're still not comfortable with it, find another medical care provider.
Medicine isn't about color. It's about the health and the welfare of people and their human rights.
Another issue entering the conversation more than ever is access to abortion. Abortions are an option for expectant mothers dealing with life-threatening complications. But the recent Supreme Court ruling to overturn Roe v. Wade could impact women of color more than others. New research from the University of Colorado Boulder shows banning abortion nationwide will lead to a 21% increase in pregnancy-related deaths for all women. They anticipate a 33% increase among Black women. The study also shows the increase in deaths would be caused by more women carrying a pregnancy to term. The study says live births end in death of the mother 14 times more than abortions in the U.S. The branch of Planned Parenthood covering Iowa says there's also a financial aspect to consider.
We know that forced pregnancy and forced childbearing with all of its risks can represent a significant threat to a woman's life and health. And because women are no longer able to make their own decisions in many states.
And we're also seeing that these maternal morbidity and mortality rates are highest in the states that are banning abortion. We know globally that access to legal, safe abortion is one of the most important ways to decrease maternal mortality. We're turning back the clock here.
So it's important to clarify the overturning of Roe v. Wade does not ban abortion nationwide. The ruling puts the power to decide any restrictions to the states. In Iowa, Governor Kim Reynolds has made it clear that she wants to impose further restrictions on abortion. Right now, abortions are banned after 20 weeks. However, the governor wants the courts to reinstate what's known as the fetal heartbeat law, which would restrict abortions after 6 weeks before many women know they're pregnant. That law is currently blocked. And earlier this month, an old law was revived requiring women to wait 24 hours after requesting an abortion. For now, abortion remains legal in the state, but with Republicans in full control at the State House, further restrictions are expected. The governor told KCCI as an alternative to abortion, she supports making birth control and family planning centers easier to access. One option in the metro is Agape. They market themselves online as the abortion clinic alternative. And we reached out to the center to discuss the topic of maternal mortality in relation to the abortion rulings, and they sent this statement. Agape is here to provide assistance, support, and community through a variety of pregnancy and parenting services. No matter what your story, we are here to provide support to the Des Moines community. Still to come, making sure the future of modern medicine is up to speed.
How do we educate ourselves? How do we educate our students?
We need to address this in how we take care of patients right now.
Plus, the statewide effort already underway and how hospitals are setting a high standard for staff. Welcome back. There's an effort underway right now to improve maternal care in Iowa. The State Health Department and the University of Iowa are working together on it. It's called the Maternal Quality Care Collaborative. And they're trying to improve issues in several areas, including racial disparities, seatbelt safety, and reducing C-sections. Now, doctors say C-sections are more dangerous because people can experience more blood loss and complications. ICU care or hemorrhage are also more likely. The University of Iowa hospitals say they've already seen the rate of C-sections go down over the last year. Now, some doctors are also on a mission to pass along what they're learning to their students, especially when it comes to closing racial disparities. Now, we spoke with two of these doctors who are both adamant the mistakes of the past should stay there and be used for a better future. Dr. Rebecca Shaw at Des Moines University says it starts the moment her students walk in the classroom.
Day one, incorporating in the curriculum material to combat implicit bias, to help students recognize their biases, to help them learn how to deal with them, how to address them.
Everybody has implicit bias, and it doesn't make you a bad person to have implicit bias. It just simply means that you've been raised in a society that's biased, and we have absorbed this. And Despite the best intentions, your bias may come out in how you provide healthcare to people.
Dr. Stephanie Radke at the University of Iowa says her curriculum incorporates lessons based on ancestry, not race.
They really help students understand the difference between ancestry and race, and that race is really kind of a social description that is really based on someone's outward appearance, but it doesn't really correlate with like their genetic makeup.
But the work isn't done there.
It's going to be a very long time before today's medical students are the leaders in healthcare, and education that the students receive in the classroom has to be complemented by what they experience in their clinical teaching and their clinical training. Because if they observe people practicing in a way that differs from what they were taught in a lecture, what they're seeing in clinical practice is going to make more of an impression on them.
Institutions like hospital systems and clinic systems have to implement their own strategies for combating implicit biases.
Now, one way to achieve that is hiring upper level management whose sole responsibility is diversity, equity, and inclusion. So here's what the Metro's 3 main healthcare systems have in place right now. Unity Point has a Black Doula project. Their chief diversity officer says it helps link Black parents with a doula in an attempt to increase those who get prenatal care in the first trimester. Mercy One's DEI officer works to develop relationships in the community through different organizations and events. Its parent company also emphasizes the need to reach out to minority and low-income communities. And at Broadlawns, they see patients who speak 40+ different languages every week. They have 10 interpreters and an online translator service to help. Their DEI officer says they work to accommodate different cultural traditions during the delivery process. In 2 minutes, the helping hands waiting for parents to reach out before, during, and after pregnancy. Over the last half hour, we've thrown a lot of information at you. Our hope is we can make sure all women have support during and after pregnancy by bringing these stories and this data to the forefront. The issue is already gaining national attention. The White House designated this week as Black Maternal Mental Health Awareness Week. Here in Iowa, Mercy One, Count the Kicks, and Healthy Birthday, Inc. held a panel discussion discussing the topic. Now, many of the experts we spoke to continue the conversation and discuss real solutions that can be implemented in our state. Until then, if you or someone you know is struggling, the first thing to do is to speak out. Immediately contact a doctor or your doula if something doesn't feel right or if you feel like you are not being heard. And remember that your maternal health doesn't stop after the delivery. There are also ways to get support after you have a child. And one of them is here in the Metro, Every Step. Nurses will pair up with first-time mothers until their child turns 2. You can also seek mental health services near you, and many doulas have contracts that list therapists in your area. Now, these tough conversations to end maternal mortality, especially among women of color, won't and shouldn't end here. Let's keep talking. Let's save our mothers. Thank you for joining. Have a great evening.